Welcome to Medicine Talk ND Live, where you can discover life without medicine. Join us live 12 to 1 CST every weekday, where you can talk to a naturopathic doctor for free and learn more about naturopathic medicine. ND Live is brought to you in partnership with FullScript, the doctor's choice for delivering the safest source of professional-grade supplements to their patients.
Hi, everybody. It is Eli Camp here, one of the founders of Medicine Talk. And as you know, we are doing interviews with the doctors who participate in ND Live because we thought you might like to see them and hear from them other than just on the phone. And today I'm really honored to have Dr. Samm Pryce with us.
Hello. Good morning.
Thank you for taking the time. So your practice is in Ann Arbor, Michigan.
It is.
Is it cold?
It is. Actually, we got snow on the ground yesterday.
I'm so jealous. I'm so jealous.
You can have that.
We had fog this morning.
Yeah, well, okay.
No. So, you know, I think people out there are really curious about our doctors. And tell us a little bit about why you became a naturopathic doctor. How did that all happen?
Honestly, I think this was more personal for me. My father had multiple sclerosis, and my family, my mother researched, and he went to an MD, and he was diagnosed at the same time one of his cousins was diagnosed, and he went the naturopathic route, and his cousin went the conventional medicine route, and the cousin was deceased within, I think, 2 years of the diagnosis. My father was in remission for 15 years. Nobody didn't, I mean, you would not know that he had multiple sclerosis. He was walking fine. We all went on a very specific diet. So I actually grew up with naturopathic medicine. Then when I was actually in college, thinking that I was going to be a cardiac surgeon, I came down with, right, exactly. I came down with hepatitis A, which is, you actually get that from tainted food, and I got it from a bad batch of strawberries that was in the town. Third documented case in New Orleans. And the doctor said, oh no, you just kind of have to wait for your body. It's self-limiting. So you just have to wait for it to pass. And I was like, what? You can't give me a pill. You can't operate. You can't do this. So I was in the bed for 3 weeks reading, and my mother sent me one of those books, the same one that she found that led her to my father's naturopathic physician. And I was like, wow, this is so cool. It really resonated with my heart, my soul, and it was a done deal from there. So that is how I ended up being a naturopathic medicine. In fact, I was talking to my husband yesterday about naturopathic physicians in general, and I really think that we are a group that thinks outside of the box, and it takes a very special person to do that, to not see everything in black and white, and to be able to color the different shades of gray is what I call it.
I agree. I think naturopathic doctors do that really well, as well as, you know, treat people individually, and everybody's a puzzle and it's unique, right? 50 people with a headache.
And that's what I love about my job.
Yeah, exactly. And you went to Southwest College with me, so confession. I've known Dr. Pryce for a long time. We went to school together.
Yeah, we grew up
Michigan?
I got married within 6 weeks on eHarmony.
There you go.
Another story.
That's awesome. That's awesome. So, you know, we are asking all of the doctors to give up a little free stuff here. And I decided to focus on herbs and have every doctor tell us their favorite herb and why. What's yours?
I'm going to have to say milk thistle. I do a lot of environmental medicine, and I do a lot of oncology, and you know, with Dr. Kringen being one of my mentors, the liver happens to be that organ that's just phenomenal, but it takes a really heavy load, and it is the organ that detoxifies not only the foods that we're eating, but our environmental nastiness that's going around us. I really honestly, my heart think that it detoxifies the stress and the emotional stuff as well, you know, like people that are around us. And milk thistle is one of those herbs that actually kind of like just hugs the liver and helps it detox. You know, we can get into castor oil packs too, but if I have to choose an herb, it's definitely milk thistle, and the fact that it's going to help that organ that has such a burden and a low body.
Yeah, it is a great herb. I agree with you. Now, you did a residency with Dr. Peter D'Adamo.
I did.
The author of Eat Right for Your Blood Type.
That's right. And he wrote the genotype diet while I was his resident. And so a lot of what I do is what we call now generative medicine, are looking at specifics in our genes and SNPs, our mutations in our genes, and what makes us individualized. So some people call it personalized medicine, we call it generative medicine, and the way in which diet or food can really be your medicine. That's my, like the top layer of anything that I do for someone. You know, everything's individualized, but we start with diet.
Right. Well, it makes sense, right? It's a cornerstone of our health.
Everything.
And
Yep.
you have a concierge practice.
I do. So
Tell us a little bit about that.
yep, all of the patients are on a year-long contract. I really like this model because you're not nickeling, diming, and people aren't saying, oh, well, I'm not going to go call her. I'm not going to come back because I don't have the $50 or the $100 or the $150.
Right.
I'm pretty cheap, I think, too. So I just want them to come in. I really want my patients to get better. So I want you to know that you've invested in yourself, and that you can call me, you can text message me, you can email me, we can Skype, we can do whatever you want to, whatever mode of communication is best for you. That's where I meet the patients. So some of my patients, I never see them. They text message me all the time. Other patients never call, they come in and sit face to face. And I'm fine with that. However you want to do is perfectly fine. But I love the concierge model. I think that I know my patients very well. More so than when I was doing it the other model. I don't take a lot of patients. I will only take 100 patients per year. I really get to know my patients, their ins and their outs. I know their family. So I like this model.
It's almost like the old-fashioned
Absolutely.
doctor, where we are the family doctor. We're the tribal healer. Yeah,
Absolutely.
it's awesome. Okay, so I know you have a patient coming in just a few minutes, so tell people how they can find you, and it'll go up on the video as well. So. Okay,
so balancedintegration.com, www.b as in boy, ALANCED, integration, INTEGRATION.com. And the email address is on there, all of the Twitter feeds, LinkedIn, Facebook, whatever, it's all there. There's a blog on my website. I pretty much post 3 to 4 times a week on Facebook and Twitter, so lots of good information there as well.
And you are taking new clients?
I am taking new patients.
Excellent, excellent. Okay, well, I'm going to wrap this up. Our next doc is just coming on board.
Yeah, hi, Jason.
Hi, Dr. Finley. Okay, listen, happy holidays, Dr. Pryce.
Happy holidays, everybody.
Thank you for joining us.
See you later. Bye-bye.
Bye.
Visit medicinetalk.org to join us at ND Live today. And be sure to ask your doctor about Full Script.